afternoon, good evening. Thank you so much for joining us for the weekly briefing from Africa CDC. My name is Margaret, Edwin, the Director of Communications. I'll be moderating this session. Today, we are joined by His Excellency Dr. Kaseya, the Director General of Africa CDC, who will be taking us through the situation analysis. I will now hand it over to Dr. Kaseya to start the session. Over to you, DG.
Thank you so much, Margaret. Good morning, good afternoon, good evening. So happy to be again with you. Last week, I didn't manage to be with you, and it was Dr. Ngashi because I had some meetings with senior officials in the US. We'll give you an update on a number of situations that Africa CDC is managing. Let us start with the presentation that will help us to go through that. Next slide, please. Our first slide today is just to celebrate with you the annual report 2024, Africa CDC annual report. You have the link. I think, I hope that all of you, Margaret has your email address. We can share with you the link. But this is a 148-page report showing the success of Africa CDC in 2024, supporting African continent. We are also highlighting a number of challenges that we had, like this increase of outbreaks from 2022 to 2024 by 41%. This is a huge increase, and we're discussing that for some weeks and the way we need to deal with these outbreaks. We are sharing the story of Africa CDC taking the lead for the Declaration of Public Health Emergencies of Continental Security, and the establishment of the our IMST, this is the Incident Management Support Team, as the new way to coordinate all multi-country outbreaks. We have a lot of success with IMST, coordinating Mpox, Marburg, Ebola, and so many other outbreaks. We are discussing also the health financing issue because we started to see the decrease on the official development assistance, ODA, and what Africa CDC took as action to bring head of state and ministers together to see how to increase domestic resources and innovative financing. To do all of that, we need also to think about DNA, that is the strengthening health system and strengthening the surveillance system across the continent. You will see in this report a number of areas, a number of programs where we made clear progress. We are glad that one of the progress we made is about local manufacturing, where we managed not only to launch new initiative, what we call the Platform for Harmonized African Health Manufacturing, but also for the African Pool Procurement Mechanism. And this one, sorry, there is a echo. Yeah, for this one, sorry, my colleagues are, okay, now we can continue. For this one, we managed also to raise around $3.2 billion from AVMA and this initiative from Gavi and also from Afreximbank. We have funding to support African manufacturers when they need, and we are so proud of that, and we are continuing to mobilize some additional funding. Yes, in 2024, the governance of Africa CDC improved a lot, and we have also our governing structures working that supported us to, play our role as convening power in Africa. Next slide, please. When we talk about sustainable health financing, we talk about this crisis we have today. I think the past 2-3 weeks, we started to discuss that. You know the figure, more outbreaks, less resources. And we took the initiative to consult Minister of Health, Head of State, African Union Assembly, and the various colleagues and partners. Then I'm glad to inform you that today we are launching this concept paper, what we call the health financing in Africa in the new era. And you will receive that today or tomorrow. That Margaret will share with you. This is a very solid document that is providing the 3 key pillars: more domestic financing through strong National Health Development Plan and the National Health Financing Plan. The second pillar is more innovative financing, where African countries accept to use some tools to make more resources for the health sector, like some taxes or using some opportunities, health insurance and other like the diaspora. And the third one is about blended finance. We need more investment in Africa. We need more private sector coming and making investment by having assurance from us that we are de-risking their investment. And this blended finance is a major component. We are assuming that in this new era, we are no longer talking about more grant, but we are talking about more investment. And for these 3 pillars to be successful, we need strong governance in place, like the efficient allocation and the use of resources. We don't want to see again fraud, corruption in some of our countries. And we need also to put in place the digital system that can allow us to record information and to provide more guidance to countries when there are issues. Lusaka agenda and linked to the impact will show all donors what is the benefit to invest in the health sector today in Africa on a more coordinated way. We think that today, Africa, thanks to Africa CDC action, will learn from this crisis and will make the continent a little bit protected with our domestic resources. Next slide, please. Let us come back to some diseases by starting with Mpox. I want you just, if there is one information you can bring from this slide, is the first quarter of 2025, we have almost 50% of total cases of 2024. It means in 3 months, we managed to have 50% of total cases in 2024. What is the key message? Mpox is still increasing. Mpox is still a major public health emergency of continental security. And Mpox must require our attention and our involvement. This one is because we have new countries. You'll see like Ghana, But because we still have what we call community transmission in a number of countries like DRC, Burundi, Uganda. And we are conducting a number of actions thanks to our colleagues from IMST who are working tirelessly to support countries. Next slide will show you for some countries that we selected, starting by Ghana. Next slide, please. You will see the situation. Ghana, after 11 weeks, is reporting a new clade 2 case. The message is all African countries, if we don't sustain the cross-border activities, can still be affected. And this is the example of a country, after almost 11 weeks of no reporting, now we are reporting new cases. Next slide. Tanzania reported cases 3 weeks ago. We still see an increase. If we compare last week to this week, you see it's almost the double of cases that were notified. And we can see what is good, that we have 0 death. But for how long we'll continue to have 0 death if we don't really put in place all measures? This is why we are saying, and our message is, let us use opportunity to vaccinate. Let us use opportunity to use all tools that we are having now, not only to decrease number of cases, but to avoid to have deaths. If we go now in Uganda, next slide, please. In Uganda, we'll discuss that, but we wanted first to discuss DRC. What's happening in DRC is strange, because we can think that there is a decrease in terms of cases. We all know it's because the eastern part of DRC is not reporting today. Then it's not really the decrease. It's a challenge that we have in terms of surveillance, but the same trend we see that in terms of confirmed cases, it means the testing of Mpox cases. And this one, you will see the testing rate today is around 18%. It's too low. And it means we are missing a number of cases that are notified just because of sample collection and transportation issue. You want to know? We are clear on that. It's mostly linked to EdCat, because DRC was totally dependent on support from partners for the sample collection and transportation, but it's also due to insecurity in the eastern part of DRC. Next slide, please. Then Uganda, we can see a decrease in terms of cases. We can see this is a country where the testing rate is 100% compared to 18% in DRC. And we can see the challenge here is to vaccinate more people. And I will talk about the response in Uganda. Next slide, please. We'll see that Uganda is a country that vaccinated the first round and will vaccinate. We started the second round in beginning of April. Just to give you an idea, when we talk about diagnostics, Africa CDC, with partners, we are doing our best to support countries, providing test kits, providing qPCR machines, providing training, but we are not donors. We don't have funding to support sample collection, to support sample transportation. This is why we are saying, and I made it the past 2 weeks, I was out of Addis, meeting a number of partners, but meeting also our member states, saying it's time for us to rethink the system, because we need to see how African countries, they can start to support these areas. Next slide. Currently, we have 6 countries vaccinating out of 9 where vaccines were delivered. I was talking with the Minister of Central African Republic. They are launching the campaign. I was receiving the Minister of Liberia 2 days ago, and it's ongoing. And I will be in Côte d'Ivoire next month to see how we can kick, we can start the campaign. But for now, the 6 countries vaccinating, we have a huge success, because almost 547,000 people were vaccinated. And what is amazing, the refusal of this vaccine is almost 0. It means people, they are accepting vaccine, and people, they are accepting the message that we are giving them to be protected. Next slide. We discussed Mpox. Let us talk about cholera before moving back to Uganda with the Ebola outbreak. In terms of cholera in Angola, it's a tough time, because there is a new province that is affected, the province of Namib. And we see an increase in terms of cases, also an increase in terms of deaths if we compare with the previous week. But I met the president and the minister of health. The team, Africa CDC team, is based in Angola, providing support. Angola received vaccines from Africa CDC and other partners. It means today we are just putting together our hands to see how to stop with this outbreak. As you must know, mostly this cholera outbreak is coming from the sub-urban area, where water and sanitation is not the ideal one. And also the government is doing its best to provide these basic interventions to the population. It's a lesson for us on how we can set up our urban areas by making sure that we are planning to receive people who are coming from rural to urban areas. Next slide. I committed to discuss about Ebola in Uganda. It's a great success. We are moving towards a declaration of the end of this outbreak. We are almost 20 days after the last person being discharged. And if we continue with this trend in the next 3 weeks, we can celebrate end of the Ebola outbreak in Uganda. But Uganda, facing also Mpox, is combining the response, and Africa CDC and all partners, we are together to support the country. Uganda, as I was saying in my introduction, received additional doses, more than 100,000 doses, and this started the second round of the campaign on the beginning of April. We believe that with these doses can protect more people, in addition to the support we are providing at community level with some community health workers, they call them village health teams, deployed, and also with the support in terms of epidemiologists and other people who are coming to support the country. Next slide. It will be for us the end of this presentation. And we want you to say with us, we have a number of challenges, mostly due to the decline of ODA and all news that you are hearing. We are having a strong approach on the way to deal with the issue by also remaining open to our partners. With that, Margaret, I'm back to you for questions from colleagues.
Thank you very much, DG. Let's take the first two questions from the chat group. We have Sarah Carter from CBS News. The question is about the Ebola outbreak and how severe it is in relation to US government cuts. How have those affected the work on this outbreak, and how will it affect future outbreaks, knowing that these viruses are cyclical? That's the first question. And then the second question comes from Anadolu Agency. This is James. The question is, how far has Africa CDC gone with securing a humanitarian corridor for the Eastern DRC? I will hand it over to you for those first two questions, DG.
Thank you. Not only Ebola, but Mpox and all other outbreaks we are facing, without appropriate funding, we cannot respond. We got a number of commitments, a number of pledges, but today we see a decrease, not only from the US, I have to repeat it on a daily basis. US is cutting. You will see that in the report. We are providing almost 12 countries with the level of aid cut. In our report, we are saying we are moving from $81 billion from 2021 to $25 billion in 2025. 70% of the decrease, and only for the past few months, we got almost 40% of the decrease of ODA. Less people to be trained, less countries to be equipped, less medical countermeasures, it means vaccine, medicines, and diagnostics. And the response is not optimal. It means we are all of us at risk. Our message to our colleagues from Western countries, you are not protected, because if there is a pandemic coming from Africa, you will be affected. Regarding the humanitarian corridor in the eastern part of DRC, I got a report today about a major measles outbreak in South Kivu. I got a report about other outbreaks in this region, North Kivu and South Kivu. We don't have access to this region. Our leaders, you are following that on a weekly basis, they are meeting, they are looking for political solution. We are talking to them. We are telling them, you need to accelerate. And they are listening on a regular basis. I have calls with them. We hope that there will be a solution very soon. The trend I see, the information they are providing to me, I'm telling them, once we have this guarantee from them, I will be the first person to fly to this region to bring medicines, vaccines they need. I think this is what I can say. Africa CDC is not a political player for the peace security process that is ongoing, but Africa CDC is an actor, a humanitarian actor, telling our leaders that we need that. Over to you, Margaret.
Thank you, DG. We cross over now to the floor. We have Janice from Bloomberg. You have the floor.
Hi, thanks again. I just wanted to circle back to the comments around the innovative financing. It's a few weeks now where we've heard how critical this is. And last week, as you were all in DC, there were comments around health as a business, rather than something that functions on grants. I've heard you talk about, possible airline tax levies or sin taxes or health insurance, etc. But I was just wondering, last week we heard that the discussions were quite advanced. I was wondering if you could comment at all about where exactly in the private sector, you're looking or who you're speaking to, maybe just anything more that we could get out of which companies might be involved. This idea of not just a partnership between companies, but philanthropy organizations as well as various governments. Like, how do you bring those four together?
Thank you, Janice. Let's take the next one before DG comes in. We have Dorcas from BBC. You have the floor.
So my question, I have two questions. One is just to circle back on what you said about measles. Could we get a situational update on the measles outbreak in the DRC? Because I understand earlier this week, the Ministry of Health did report that 199 children had died, but the cases were spread across different provinces, including those in the north, Equateur, Tanganyika, which are not necessarily in Eastern DRC. So what is this pattern of spread telling us about measles? Is there anything peculiar, particularly in the other areas which are not in the eastern part of the DRC? And my second question is, you mentioned after your visit in the United States, was there any tangible outcome? Are the donors listening? Are they pledging to not cut back all the aid that they're giving?
Thank you very much. Over to you, DG.
Thank you. Thank you so much. Let me start with Janice. Africa CDC is a political body. We are not the NGO. We are not a multilateral organization. We are more than that. We are the convening power. And for us to make a decision, we need to go through a number of consultations. Member state, and when we talk about member state, we talk about head of state, Minister of Health, Minister of Finance. We are talking about private sector. We are talking about philanthropies. We are talking about our partners. What did we do? And with the concept paper we are releasing today, you'll see what is written there with a lot of details. Innovative financing, there are a number of avenues, but one of them, as you are saying, is some taxes. To put in place taxes, first we need the political buy-in. I can say at this level, we secure the political buy-in. What people were waiting for was this concept paper. And we also managed to put in place what we call the Ministerial Committee on Innovative Financing. We have 12 ministers. We have also Minister of Finance coming to join them. We have also some experts, African experts. We are also open to have other experts joining them and putting in place quickly the phase 1, the phase 2, the phase 3, how to implement that. Our role as Africa CDC is to be the secretariat of that. I can say today, 50% of the job is done. We are, we had a conversation with World Bank. We are having a roundtable during the spring meeting in April in Washington, bringing some of our ministers of health, sitting with all ministers of finance, with World Bank, IMF, Africa CDC, and other partners to see how we start to operationalize that. I think, Janice, this one, we made a lot of progress. We are talking with private sector in Africa. Dangote is a good friend of mine, Tony Elumelu. We are also talking with private sector in other parts of the world. We are talking philanthropies, Gates, and others. We think that today we are very well prepared then, as it was the case it was not the case in the past. Today we are very well prepared to launch this innovative financing mechanism. Regarding Dorcas, I will start with the second question because colleagues who are in Kinshasa, they will answer about measles. Yes, after Denmark, Sweden, and Norway, I flew to US. I was there last week. We had meetings with senior officials from State Department, White House, HHS. We had even opportunity to have a meeting with all US agencies working in the health area together. It was a 5-hour meeting that we dedicated with them to discuss all aspects. We had meetings with senators, and we had meetings with some people who are helping to make decisions in the US. Our message was clear. We know that we'll never again pretend to get the same level of assistance as it was in the past. We know that. But we want them now to support our approach, the 3-pillar approach. I got full support from the US regarding our 3-pillar strategy plan. The second one, we said it's not time for us to innovate on the way to provide assistance to African countries. We want also to see African countries being supported because they are doing something to support their own health systems. And they also agreed with us that this is the way to move forward. We also agreed and we got clear commitment for more investment from the US to African countries, especially in local manufacturing, electrification, digital health, and supply chain infrastructure. We didn't request, and I'm clear on that, we didn't go there to request the same level of assistance for HIV, TB, malaria drugs. No, we are requesting for a mature collaboration and partnership. I think our message today is very well understood. And what I'm getting as feedback is so positive from all countries that we visited. Dr. Yap and colleagues, can you please provide more information on the measles in DRC?
Thank you so much, DJ. Good afternoon. I am Kermasi, and I am currently on the field, and I'll be providing the measles update. So currently, that's 2025, we've had over 12,000 cases of measles, as well as over 180 deaths that have been reported across all the 26 provinces in DRC. But the top 3 most affected provinces include Myanmar, North Kivu, and South Kivu. And as you're aware, these are North Kivu and South Kivu are currently plagued with insecurity, demonstrating that this is just the tip of the iceberg in terms of detection. And the IMST is working very closely with the country team, as well as the different provinces to explore options around supporting these different provinces. In addition, what we are doing is also looking at an integrated response approach, whereby the current response measures and interventions that we are putting on the ground also takes into consideration the measles cases in these different provinces. So looking at it from case management, as well as our community health workers that have been deployed to the ground, they are going to be supporting both the detection of measles cases, as well as also the management of cases of measles at facilities in the different response measures that we put in place. Lastly, in terms of community mobilization, we are also doing an integrated approach in this light. For instance, when we're doing through the country office, when we're doing the last measles campaign in Pakajuma, we also realized that there were a very huge proportion of children, and some of these children also have also missed their routine vaccination. So all these are being taken into consideration, and some of these areas and at risk regions and areas that we have identified are also being integrated into our intensification phase of our response. Over back to you, DG.
Thank you. Back to you, Margaret.
Thank you, DG. Let's take the next question from Carmen from Politico. You have the floor.
Thank you so much, Margaret, for the opportunity. I wanted to ask the Director General, can you share any names with us of the people who you met from the White House? Just because, as we saw yesterday with the tariffs, President Trump is very much focused in bringing a lot of sort of like investment and production back in the United States. So I was curious, kind of like them, promising to invest more in African healthcare and electrification. Like, how is that going to work? Like, whether they have certain companies in mind that they want to incentivize to do that, because it would seem to be at odds with, President Trump's kind of like approach right now. The other question I have is about Ebola. There's been a big debate here in the US about whether the US is still supporting Ebola response and prevention. And the last I got from the State Department was that that was the case, that Secretary of State Marco Rubio had approved some Ebola prevention and support activities, and those were ongoing. I was wondering, because the biggest issue is whether organizations doing that are getting paid to do it. So have you seen, any restart of activities, for example, in Uganda from the US government, payments flowing to the organizations tasked with responding to the outbreak? Like, can you give us an update sort of like from the ground if things are moving, or in terms of payment, if they're still stuck? Thank you.
Thank you. Over to you, DG.
Thank you so much, Carmen. I met 2 senior advisors, and we had some closed door sessions, but you have to know I met 2 senior advisors of President Trump, a man and a woman. And we had, with other colleagues, other senior people, we had these lovely discussions. I think we're in agreement on the way to move forward. These are high-level discussions. As you know, we first discuss the concept, the vision, then we start to see how to operationalize that. What we decided is to put in place a team, Africa team with the US team, working on all ideas and concept that we developed for them now to translate that into concrete action plan. This is what our colleagues are doing currently. We need also to understand that the US, even responding to your question regarding Ebola, is moving toward a number of changes. And what we are saying as African leader, we are not dealing with this issue on a way that exposes our partner. We have our mechanism, we have the diplomatic channel, we have our meetings where we are discussing, and we know they told us life-saving humanitarian interventions will continue, and they shared with us some places where it restarted. We think we are in contact, regular contact, almost on daily basis with them. We are following everything that is done. We are also providing our feedback to them. I can say Africa CDC today managed to build strong relationship with the new administration and with the Senate and all other people, because we are working with the US component. It means Republicans and Democrats. This is what I can say, Carmen, by making sure that we are supporting our colleagues from the US to accelerate the implementation of some decisions that they shared with us. Back to you, Margaret.
Thank you, DG. Let's take the next question from Esther Nakazi, a science journalist from Uganda. Esther, you have the floor.
Thank you very much, Margaret, and thank you very much, DG. While we do appreciate the private sector coming in, I also need to understand, DG, what are your expectations from our government? Is there anything that you have outlined in terms of what you expect them to give in terms of cash, maybe in terms of, I don't know, what are your expectations? Thank you very much.
Thank you, Esther. Let's take the next one from Mohamed Bishar from Universal TV in Ethiopia. You have the floor. Mohamed, can you hear us? Okay, let's take one more from the chat group. We have Kate Lay from The Guardian. The question is, will the financial impact of Trump's tariffs make it harder for African countries to mobilize domestic health financing? Over to you, DG.
Esther, you are right. I think if you pay attention on what I'm saying, we are mostly targeting African government. It's their responsibility to provide care to their people. How can we understand today we still have countries providing less than 3 or 4% of their GDP to the health sector? These countries were expecting that US will be there forever, EU will be there forever, Gavi will be there forever, Global Fund will be there forever, World Bank will be there forever. We need to stop that. It's what I'm saying to my leaders, my head of state, and they understand that. If today we start to provide more resources, others, they will match what we are doing, others, they will respect us. Because you are from Uganda, it's the discussion I had with President Museveni, and he's supporting me in this area. Yes, our colleagues from The Guardian, you are right. I was talking with ministers from Namibia. They were telling me they have a 25% increase on taxes. The Minister of Lesotho was informing me today that it will be 40% for Lesotho. They sent product in the US. That one will not make African product competitive. This is the first one. It means Africa will sell less product and get less money. And when you have not enough funds, you have competition because you have so many priorities, it will be difficult also to make decisions. But the innovative financing mechanism we are talking about, it's above what countries can provide under their national budget. It's to put in place some tools, some mechanisms, like taxes we are talking about. A tax on the airline ticket, a tax on tobacco, sugar. That will be, we are calling that solidarity fund that can help to resolve a number of issues while we are supporting countries for pandemic preparedness and response. The solution for the future is not to see what Western countries can do. The solution for the future is to see what Africans can do for themselves, by themselves, complementing what is coming from external partners. I think this is how I can articulate that on a simple way. Back to you, Margaret.
Yes, thank you, DG. We have Oscar from the Spanish news agency. You have the floor.
Hello, thank you very much. Thank you very much. I wanted to ask you a bit more, if you can analyze a bit what you were saying about the increasing of outbreaks in Africa, like 41%. Do you have an analysis of which are the causes are driving this? And as one of the outbreaks that I've been watching these last days was like the Kalasar. Do you have a medical assessment of why is it that like in Wajir County in Kenya, they have had like 500? Hello?
Yes, we
Hello?
can hear you, Oscar.
Yeah, we can hear you.
Sorry. So yes, and then also I wanted to tell you that what I have seen there in this northern semi-arid lands is that the people, they are like the first recipes for preventing yourself from this leishmaniasis visceral, and so is to have like insect repellents and to be protected from the sandflies and so, but nothing of this is being distributed. And I think that is going to be very difficult, to have like private investors to give to make investments in poor people. No, I wonder at the end of the day if it's not about inequalities also. No, inequality is not only in the world system but also in the African countries. But most interested I was in asking you about a medical assessment about Kalasar. If you have, thank you, sir.
Thank you, Oscar. DG, over to you.
Yeah, thank you, Oscar. We have a system. I will invite you one day to visit, and I'm inviting all journalists to visit Africa Citizen to see how we are monitoring public health events on daily basis across the continent. We have this Public Health Emergency Operations Center with women and men working 24 hours, collecting information, analyzing, and I want to thank my colleagues for that. Outbreaks reflect the status of our health systems in Africa. It's reflecting the vulnerability of our health system. You have a health system where you are lacking human resources. Let me remind you that we have a gap of 6 million health workers in Africa. You have a system where you lack medical countermeasures. You will see for all diseases and outbreaks, we need to beg Western countries to give us vaccines, medicines, diagnostics. Even after 100 years of malaria, we are not manufacturing bed nets in Africa. Then, when you have lack of human resources, lack of medical countermeasures, lack of strong digital system that can help you to make quickly decision. Because if you have information today, you can make decisions and to protect, even to avoid outbreaks. In addition to that, we have climate change, insecurity, and on top of everything, lack of financial resources. These are a number of factors linked to the pillars of health system and external factors that are making the situation worse in Africa, that are explaining this increase in terms of outbreaks. But in addition to all of that, we have mutations of virus, as we saw for Mpox, as we saw for COVID before. I think all of these factors together are not giving us the confidence to say 2025 will be better than 2024. About investment, I was in Norway a few weeks ago. I went to visit the National Public Health Institute of Norway. I was told that this institute was built by Rockefeller. And the reason Rockefeller built that, because at that moment, Norway was a very poor country. Meet people from Norway, they will tell the story. It was a very poor country. And Rockefeller was thinking, how can I help them? He did the same in Denmark. The first center manufacturing vaccine in Denmark was built by Rockefeller because Denmark was a very poor country. Today, Norway is one of the richest countries in the world. People will think that Africa will remain poor forever. They are making a mistake, a huge mistake. Let us learn from Norway. We have a continent of 2.4 billion people in the next 20 years, the biggest market in the world. It means it's time today to invest. This is my message to everyone I'm meeting. And I can tell you we are making progress. In local manufacturing, we have today more than 540 manufacturers in Africa. And all initiatives I'm seeing, maybe by the end of 2025, we can reach 700. More coming for vaccines, more coming for other commodities. And things are moving in Africa. I think, Oscar, because you are from Spain, say to Spanish investors that it's time for them to come to invest in Africa. They will get a lot of return on investment. Back to you, Margaret.
Thank you, DG. We have another extra question from Dorcas of BBC. She asks, could you provide a situation update of cholera in South Sudan? We understand that the outbreak has also spread to neighboring Ethiopia. We also have a question on the floor from Andrew. Andrew, if you can hear us, you have the floor. Andrew, can you hear us? Okay, you can take that one.
South Sudan today is affected by insecurity. You will see countries affected by insecurity are also affected by a number of outbreaks, like what we are talking. Around 1 million people in South Sudan are affected by cholera. 1 million. And that killed around 799, around 800 people. And this is a major crisis. As I was saying, we lack vaccines. We don't have vaccines to stop this outbreak in South Sudan. This is why we need to continue to push for local manufacturing. Now, from South Sudan, we have a number of countries affected like Ethiopia, but 1 million people. affected by cholera in South Sudan. I think, Dorcas, I provided information to your question.
Thank you, DG. We have a question on the Mossad trial for Mpox. So the question is, how is that progressing so far? Over to you.
I know that Professor Mosoka is attending. Professor Mosoka, can you please update our colleagues on the clinical trials on Mpox?
So basically, the Mosaic trial has a one site. The good news is that we've enrolled 15 participants. We had our first data safety monitoring meeting. They reviewed the safety data and asked that the study continues. We're going to have the second data safety monitoring at 40 patients. We have initiated discussion with scientists in Uganda to see if we can start a second site. At about 100, we'll do analysis for efficacy. But so far, it's ongoing. We are recruiting participants, and the safety first gap for safety analysis has shown that we can continue the study, and it's an antiviral to brancidifovir. Thank you very much, DG.
Thank you, Mosoka. Margaret, back to you.
Thank you, DG. With that, we have come to the end of this briefing. I'll hand it over to you for your closing remarks.
Thank you so much, colleagues. I think we started by sharing with you, because Africa CDC is accountable to our member state, to our communities, to our partners who are providing a lot of resources. We need to tell them what we are doing with resources we are getting from Africa and from other continents. We released this comprehensive annual report. It's the first time that we are releasing a report of more than 50 pages. This 148 pages is giving you everything you want to know about what Africa CDC did in 2024. Margaret will share the link with you because we are making it public today. We also said we released today the health financing in Africa in the new era, the concept paper, where you will see how we are approaching the domestic resources, innovative financing, and blended finance. These are the two major tools that we have that will drive our agenda by learning from what we did in the past. We want to say also, based on the evidence on data, that Mpox is still a major public health issue in Africa. First quarter, we have almost 50% of what we had in 2024. What will be the trend if we don't stop that? If we don't have testing capacity due to insecurity, due to head cut, we need to know, and our partners in the North must know, that they are not protected. We saw in 2 years, 2 mutations of Mpox. What will be the third one? What will be the fourth one? All of us were exposed. We want also to say, with the vaccine that we got, people are accepting the vaccine. More than 70% of people vaccinated for where vaccines was available. And we want also to say that it's a shame for us as Africans to see millions of people affected by some outbreaks like cholera without having the tools to support them. Local manufacturing will remain a major agenda for us. We thank all of you. We'll update you on the progress we are making next week. And thank you so much, all of you.